Hi, my name is Andrew Van Wieren. I'm the Chief Medical Officer and an internal medicine physician at Malama I Keola, a federally qualified health center on Maui. Colorectal cancer kills more than 50,000 people in the United States each year. This is tragic because many of those deaths could be prevented with early detection. We have very effective screening tools for colorectal cancer, including colonoscopy. These screenings save lives. Unfortunately, too many people do not have access to colorectal cancer screenings. This is especially true of the population that I serve here on Maui. Many of the patients that my clinic serves lack ready access to colorectal cancer screening because they are uninsured or underinsured. There are other barriers that exist to colorectal cancer screening, such as logistics of getting a colonoscopy on Maui. But the fact remains that colonoscopy is the gold standard for colorectal cancer screening. There are other methods, such as home-based stool tests, that are also valuable screening tools. But if one of those tests shows a positive result, the next step for the patient is a colonoscopy. But in Hawaii, even if a patient has had a positive stool-based test, it is extremely difficult for them to get a colonoscopy. Sadly, at our clinic, we have had multiple patients with positive stool tests who have attempted to obtain access to a colonoscopy and have been unable to do so. Studies show that the longer a patient waits between a positive stool test and getting a colonoscopy, the more likely they are to be diagnosed with a later stage of colon cancer. And importantly, we have the means to successfully treat colon cancer when it's detected early. One way to create access to colonoscopies for uninsured patients would be to allow Medicaid to cover these colonoscopies. Increasing access to guideline-recommended colorectal cancer screening would lead to a healthier Hawaii. No patient should be denied access to a health screening that could save their life because they lack sufficient health coverage. It's just that simple.